So my name is Nehal Shah, I'm one of the consultant radiologists at the Hampshire Hospitals Foundation Trust. And as a radiologist, I look at peritoneal disease, particularly with pseudomyxoma and peritoneal carcinomatosis. The key messages that I want people to take home are, firstly, the peritoneal cavity is very complex. But even though it's complex, disease occurs in predictable places. And they're the areas that I want to look at: the subphrenic spaces, the subhepatic spaces, the paracolic gutters, the pelvis, and the small bowel mesentery. Another point is the small bowel can be the rate limiting factor when it comes to operating on these patients, and that's why it's important to use oral contrast in following up these patients. When we have the oral contrast, we can see if there's any transition in the small bowel, if there's any obstruction, and how much of the small bowel is affected, and that can aid the surgeons into making an appropriate decision as to whether or not this is a surgical candidate. A final message is not all nodules in the peritoneum are malignant. So even though we may describe things on the follow-up imaging, they may not be significant or appropriate to that patient's follow-up, and they may not be malignant. Post-surgical changes can look very similar to disease, and that's part of the reason a lot of these patients are followed up.